If you've woken to sensations or pain above your injury level and the pain is really bad, try sitting up in bed if you can, or transfer to your chair so you can move to a different room for a few minutes. Over time, you'll figure out what works best for you. Ideally, you'll know what the least amount of repositioning is needed for you to interrupt the pain and reset your mind so you can calm the pain sensations and go back to sleep. Once you're in a comfortable and safe position, start to focus on your breath. Take a slow, gentle breath in through your nose and exhale long and softly through your mouth. Notice where you feel the breath coming in and going out. And tell yourself, I'm safe right now. Sometimes when we're quiet or asleep, the brain becomes more alert, as if it's standing guard. Those signals of tingling, tightness, or burning, they're just the brain's way of checking in with us. It wakes us up because it wants us to confirm that we're okay. It's both unfortunate and unnecessary. Even though these sensations are above our level of injury, they're just false alarms from an overprotective brain. We need to reassure our brains. We can say out loud or internally, I'm safe. I know there's no structural damage. I don't need to be experiencing these sensations. I can rest now. Take 3 nice long breaths. Now let's turn our attention to the sensations that we're feeling. Notice what's actually there and describe it to ourselves. Observe those sensations. You're not trying to change them or make them stop. You're simply learning to be comfortable in their presence. Imagine you're lying on a beach, watching the clouds drift by, different sizes and shapes. You can't change them, of course, but you can observe them, and doing so is calming. As you note the characteristics of the sensations in your body, remind yourself, this is my nervous system on high alert. These sensations are coming from my brain. I don't have a structural problem. Each time you notice the sensation without fear, your brain learns that it's safe and those sensations causing discomfort are unnecessary. Now bring your awareness to the space around the sensation. Notice that even while this feeling is here, you're okay. You're breathing, you're supported, you're resting. You can think or say softly to yourself, thanks, brain, but I don't need protection right now. I'd rather be sleeping. Continue to focus on your breath again. Breathe in through and then out through that sensation. You're not trying to change it, just give it some space. Tell yourself, I'm safe. Those sensations are just noise. There's nothing wrong with my body. I'm safe. I can sleep. With each exhale, let that warmth expand just a little further. Because this pain is plastic and not structural, if you can, gently touch or massage the area of the sensation. You can also gently rub your arms or gently scratch or tap the top of your head. Doing this sends comforting signals to the brain, potentially interrupting the discomfort. We could show our nervous system, my upper body is fine. Movement and touch here are not dangerous. We can even say it to our brains, my upper body is fine. Movement and touch are not dangerous. Try not to be upset or disappointed that your brain is giving you these false sensations when you'd rather be sleeping. Frustration can actually feed the brain, which can then increase the discomfort. Instead, try to be patient with your brain. Treat it like a small child. Tell it, hey brain, I know I'm too busy during the day for you to bother me with these sensations, but honestly, I'm good. I am safe. Just because I've slowed down to sleep and it's quiet, that doesn't mean you need to wake me up and remind me you're worried about something. I know I'm safe, so I'm just going to focus on my breath for a little while, and then I'll sleep a little more. If you don't fall asleep again, that's okay too. You can just get a jump start on your day and find a chance to nap later. Check in with those sensations again. If they move or change or fade, let them. You're not trying to control or resist them. Simply allow them to coexist. The more accepting you are, the more the brain relaxes its guard. If the sensations do change, that's even more evidence that the pain is plastic and that the work you're doing is making a difference. Now notice your breath again. Slow, rhythmic, easy. Remind yourself, your body knows how to rest. Each calm breath is a signal to your brain, no danger here. Say quietly, I'm safe, I'm healing, my body can rest. When you're ready, lay back down in your bed. Continue to focus on each in and out breath as you drift back towards sleep. Let your breath guide you, slow and steady. You brought yourself to a better place. Well done.